Welcome to Fertile Talks with Dr. Yemi Famuyiwa, a space where science meets the soul of fertility. Today's episode is proudly sponsored by Montgomery Fertility Center, a unique concierge fertility practice in Rockville, Maryland. At Montgomery Fertility Center, we combine compassion with precision science to meet every individual's need. It is a place where you'll feel heard, supported, and truly cared for. If you're ready to begin your fertility journey or just need clarity on your next steps, give us a call at 301-946-6962 or visit us online at montgomeryfertilitycenter.com. And before we begin, I want to share something close to my heart. My upcoming book, The Quest for Fertility, coming spring of 2026. This is a must-read for anyone preparing for fertility, thinking about preserving it, or supporting someone on that path. What makes this book special is that it goes beyond the science. It's soulful, a story-driven exploration of real patients' journeys and how they found hope, healing, and strength through fertility challenges. If you'd like to join our Quest for Fertility support circle or get updates about the book's release, visit montgomeryfertilitycenter.com and send us an email. Now, let's dive into today's episode of Fertile Talks, where we'll explore the science, stories, and soul behind the journey to parenthood. Hello, welcome to another episode of Fertile Talks. Today I want to talk about something I've noticed a lot in my practice, and that is the fact that most people do not actually fear IVF as a process in itself. They don't fear IVF. What they fear is their preconceived notion of what IVF should be. And sometimes that preconceived notion, that version, is usually wrong. It's not what IVF is all about. But when something is sometimes unclear, then the mind is going to fill in the gaps, and sometimes it doesn't fill it accurately. Today, I want to walk you through what fertility treatment actually looks like from the inside, right? Not from social media, not from Google, but from a clinical point of view. Because when you see something closely, you may make different decisions, right? So I see this every single week in the clinic. Patients come in expecting something overwhelming, something invasive, and they're apprehensive, something they're not sure they can handle. But what they are reacting to is not necessarily the process itself, it's the uncertainty that comes with it. So, from a cognitive standpoint, when the brain lacks a clear model, it defaults to worst case scenario. So this is not just emotional, it's neurologic, it's protective of the brain. But infertility, it often becomes paralyzing. And I've seen that paralysis in several patients. So what IVF actually looks like, let's replace this imagination with reality. Fertility treatment is not one big, dramatic moment. It's really a sequence of events. It includes initial evaluation, the initial consultation. And then when you decide because it's appropriate for you, not because the doctor wants to push it, proceeding to IVF involves morning visits, sometimes afternoons, structured around your schedule. It's brief, it's structured, it's data driven. It involves hormonal stimulation. It's designed not really chaotic. And then there are critical timing decisions that have to be made. And those matter more than most people actually realize. Sometimes I tell patients I can control when we start, but what happens after that, we have to sort of respond to the way your body's responding. So the egg retrieval is a controlled medical procedure, right? It's not an ordeal. It comes from the part that no one prepares you, right? So the part you're not prepared for involves the waiting for fertilization, waiting for the embryos to develop to the appropriate stage, waiting for the results, especially if you get genetic studies done, waiting for the results of that, and then finally the embryo transfer, which is often much quieter, much faster than most people realize. Sometimes patients will go, "Oh my gosh, it's done." And I go, "Yeah, it's over." So if you're at a point where you're trying to make sense of it all, right, and when to start, where to start, what your options actually are, my team and I care for patients in Montgomery Fertility Center, and we guide patients through these decisions every day. So now let's do a deeper dive, a deeper insight to where the real weight lives. Here's where most people get it wrong. The intensity of IVF is not primarily physical, it's psychological as well. The waiting, the interpretation, the meaning assigned to each step. So two patients can go through the exact same cycle but have completely different experiences. And that's not because the process changed per se, but because their understanding may have, right? So this is where sometimes the gap lies. The gap is not necessarily information. Heavens know there's more information available now more than ever. Sometimes the gap is in understanding, and that distinction really matters because information without context creates anxiety. So understanding creates direction, right? So let me ask you a question. Would you want to know exactly what each step feels like before starting? Or would that make the process more overwhelming, more daunting? Most people assume that more detail increases fear. But in reality, more detail sometimes clarifies things and helps to reduce the fear. So today we talked about a critical but often overlooked reality. Patients are not reacting to IVF. They are reacting to the version that they have imagined it to be. And when that imagined version is replaced with clarity, decisions sometimes change. So if you're thinking of, if you're navigating infertility or even just thinking about your real next step, you can schedule a consultation with my team at Montgomery Fertility, and we work with patients locally and across the country. And our goal is to help you move forward with confidence, with more clarity, with more visibility. So before we go, I want to ask you a small favor. Right now, about half of you who are listening to Fertile Talks are not yet subscribers. When you subscribe, it really helps the algorithm um, with the podcast platform. So more people are able to hear this message and more people are able to be helped. So if this episode really resonates with you and you see things differently, take a moment to please hit the subscribe button. And if you want a deeper understanding of what fertility is, not just steps, how to think through decisions, timing, and options, my book, The Quest for Fertility, explores these concepts in detail and gives you a framework to move forward with intention. So, once again, thank you for allowing me to share your time. This is Dr. Famuyiwa. Till the next time. Thank you for tuning in to Fertile Talks. We hope today's episode has provided you with valuable insights and support for your fertility journey. Remember, you are not alone. Now, if you have any questions or topics you'd like us to cover, please simply leave us a comment. And please don't forget to like, share, and subscribe with a friend. Your ratings, your shares, and your reviews are greatly appreciated and is going to help us serve more of our listening audience. Thank you once again. This is Dr. Famuyiwa.